ladies and gentlemen. I'm Dr. Ken Sutter. I'm here to bring you part 4 of the paradigm shift in healthcare. Now in this section, we're going to cover the natural healing paradigm. I abbreviated NHP, Natural Healing Paradigm. What is it and why does it work? It's the shift that you have to make in your mind from the medical paradigm to natural healing. There's 4 fundamentals in the natural healing paradigm. I discovered this first back in the 80s, early 90s on my journey back from liver cancer. There's 4 fundamentals. The first fundamental is you straighten the human body out. You straighten it out. Now, I didn't put that first because I'm a chiropractor. I put that first because it answers the question of communication that the cell requires. What your chiropractor does, he gets your body mechanically correct so it can be neurologically sound. Now, everybody knows how bad a brain injury is, or a spinal injury, a severed spinal cord, it paralyzes you, and if it's above C4, you're dead. Okay, but most injuries to the spine are just little things. A little fall in the ice, a little slip, fall in the bathtub, whatever. We all have them, we go through them our whole life. So you're going to need a good mechanic. You're going to have to keep the body straight. It's very, very important. It's the number 1 rule, it's the number 1 fundamental in the natural healing paradigm. You straighten the human body out so it can be mechanically correct, which will get rid of most arthritis, and neurologically sound, because your nervous system, according to guidance, your nervous system controls and coordinates all bodily function. We talked about that in the rules. So the first thing we do is straighten the human body out. Chiropractic is the main therapy to do that. However, there are other things. We've all heard of acupuncture. Acupuncture deals with the meridians of the body. That enhances structural integrity, and it's the electromagnetic field of the body, and sometimes there can be problems in that. And acupuncture is very good at fixing those. Massage therapy, reflexology, okay? Anything that enhances your structural stability, but most of it's your spine, and that's us chiropractors. But we do that so you can be mechanically correct and neurologically sound. Now, number 2, natural healing paradigm. Number 2, clean it out. Clean your body out. Now, I just saw a little video of a girl down in Chicago that teaches this, been teaching it for quite a while now, how to detox the human body. And she made a comment on there. I thought it was interesting because she said, I've never seen it fail. And it's part of the natural healing paradigm. Clean it out. She teaches you how to detox your body. Okay, it's important. There's 5 things that need to be cleaned out. And I discovered this the hard way. There is a definite order of cleansing you need to do. Now, most people only need to clean their colon up a little bit and change their diet around. And there's a lot of stories on the internet right now, people coming back from cancer, from terminal disease, just by cleaning themselves up a little bit. Stop poisoning yourself and start eating right. Clean it out. It's very, very important. There's 5 things, what I call the order of cleansing. Colon, liver, blood, lymphatic, and last is the cells. Now, the colon and liver, mostly that's the terminal people. They need a lot of work on the colon and liver. Those are the plumbing issues. You can't have 20 pounds of rotting matter in your abdomen and expect to be healthy. A colon cleanse is ideal for that, to clean that thing out. There's 3 things the colon needs. It needs the good germs put back in. It needs the musculature to be stimulated to move the stuff through. And it needs the crud dissolved off the colon wall. John Wayne died a few years ago. His doctor said, well, the guy that did the autopsy on him anyway, said, you know, if we could open up John and taken out the 40 pounds of rotting mass he had in his colon, he'd have lived another 20 years. And the saying used to be, 80% of the diseases start in the colon. That's why. When it doesn't get on through there, it sits there and rots. You absorb all that. What's that do? That poisons the cellular environment. Bingo. So the colon is important. Next, we go up to the liver. Liver needs to be decongested. Now, I don't see this very often with regular people that are trying to get their health back, but I do see it every time with terminally ill cancer people. Okay? And the liver flush is a great thing, and I'll do a separate a thing on the liver flush at some other time. But there's order, you have to clean the body out. You do it by you clean your colon up, you clean your liver up. Once those two things are done, the blood and lymphatic clean up, and then it's a matter of cleaning the cells up. The cells are last, and that can be a problem when you start going through the detox phenomenon, and you aren't going to like that. That's one of the things that give natural healing a bad name. The detox phenomenon when you start doing the cellular cleaning. But it's doable. I did it, and it saved my life. Okay? Number 3, nutrition. Food. Got to have food again. And it has to have been alive. Okay? We discussed this when we went over the rules. Now, straighten it out, clean it out. You got to feed it correctly, and then that's going to take some studying, folks. It's going to take a responsibility on your part. There's all kinds of diets available. Here's the secret. Find out what works for you. Eat what gives you strength and endurance and allows you to get a good night's sleep. Okay? It's essential. And most of the people that are successful at curing diseases now, or eliminating diseases, getting sick people healthy now, are doing these two things, cleaning food. They're just feeding folks right and cleaning them out. And half the thing right here is to stop poisoning yourself. Okay? Just stop. No more drugs. No more drugs. The food has to have been alive at some point. Now, the fourth one, of course, is exercise. Now, everybody knows about cardiovascular training. You go out and go for a jog, and everybody knows about strength training. But when I bring people back from terminal, they need two other things. They need lymphatic movement and cerebral spinal fluid movement. Those require that you actually move. You can't be sitting on your butt on the couch. Okay? You have to actually get out and do some walking. Matter of fact, when someone tells me now, and tells me about their cousin or their aunt or something that has cancer and they've been pronounced her terminal, I says, tell her to get off her butt and go for a nice long walk. Okay? And keep on walking. Way back in 1931, I forget who the guy's name was, but the guy got a Nobel Prize for proving cancer cannot grow in a high oxygen environment. So we know what cures it, high oxygen. That gets a little complicated, and you're going to have to read my book, folks. This is The Paradigm Shift in Healthcare. I explain all that, how chemical poisonings slows liver function and how you get sick thereof. Okay, exercise. You got cardiovascular strength training, cerebral spinal fluid movement, and lymphatic movement, which actually requires movement. Your lymph doesn't have a heart to pump it through there. The cerebral spinal fluid doesn't have a heart. Okay, so you're going to have to start moving. Now, let's put all this together for us. We have the rules right out of the textbooks. Now, even though I discovered the natural healing paradigm first, we kind of have to do it backwards here. I discovered that first. That got me healthy. I wanted to know why. Had to go to the textbooks. Here's why. Design function, cellular design function, communication, clean environment, food, active. You got to stay active. Well, then I ran into the problem, why are people so brainwashed, so locked into this worship of their medical doctor? Well, what is the medical paradigm? Well, it works. Everybody knows that it works. It's crisis therapy. You cut something open, you get in a car accident, don't come and get an adjustment, you better get your butt to the hospital. I get a patient comes in with pneumonia, I send them to the hospital. It's a crisis situation. It works. But when applied to disease processes and symptoms, there's no cures. You already know that. Everybody knows that. There's no cures. 120,000 people a year prescription drug deaths. Another 300,000 hospital admissions just from the side effects. And by the way, they aren't side effects. Okay, that's a subtle psychological ploy they do to you to soften the blow. They are negative effects. 120,000, well, death is a pretty negative effect. 120,000 people a year prescription drug use. Another 90,000 secondary infections in hospitals. And good old Ralph Nader come right out and said 315,000 doctor mistakes and needless surgery. 300 people, and he used the word killed too. I read the report. And Ralph's a good old boy. He's kind of funny looking, but he's a good boy. He's smart too. So we want to take you from this, using crisis therapy as your treatment, to using this the natural healing paradigm as your treatment, because this addresses this. These are the rules right out of the textbooks. They cannot be denied. And don't argue against good old Doc Sutter here. If you're going to argue these points, go to Mr. Guyton. This is not arguable. Okay? Again, we want to go from the crisis therapy, treating diseases, to the natural healing paradigm, treating diseases, because this addresses this. Thank you very much for watching, ladies and gentlemen. View this series a dozen times or so. Really get it. It's important. Your life depends on it. We're going to need a paradigm shift because socialized medicine is coming. Thank you for watching, ladies and gentlemen. That wraps up the Paradigm Shift in Healthcare series. I want you to go to my website. I want you to buy my book, www.drsutter.com. Again, thank you for watching.